Hi, welcome to Shrinks Sharing. I am Dr. Wilona Annunciation, a psychiatrist practicing in Mumbai, India.
Hi, I'm Dr. Syeda Ruksheda. I'm a psychiatrist and I'm based in Mumbai, just like Dr. Wilona.
So, Dr. Ruksheda, this time we have some something special happening this month, and that's Children's Day. So, I want to
Yes.
know from you what is your experience working with children in the mental health sector. Like, you've been working with the mental health for quite a few years now, and I'm sure you have a number of child patients, and I'm sure their parents and the children come to you with a load of expectations and a lot of thoughts and ideas and complaints. And I'd like to hear from you, what's your experience been working with children in the mental health space?
Children are the best, aren't they? They just make everything seem so hopeful and valuable and just real, isn't it? As in, you can forget everything when you're talking to children, when you're with children, whether they're your own, whether they're borrowed, whether they're somebody under your care. So it's amazing to work with children, really. And because of, when you're working with children, it gives you an opportunity to work with the family because, I mean, you work with children yourself. So there's no way that we can work with children and help them without like the entire village coming together. So I think, but to begin with, it's very important, like when I always talk about child health, child mental health, there's so many myths and misinformations, right? That oh, bachcho ko kuch nahi hota, like oh, kids are like normal and the doctors just keep looking for problems, and kids have nothing to get anxious about, or kids don't have anything to get depressed about, or kids have no illnesses and everything's just handed out to them, everybody's looking after them, so they're okay. But that's not true, isn't it? When I both know that, and unfortunately a lot of parents out there who have children with some kind of difficulties know that there are mental and developmental disorders in children, which is to say that okay, it's not like oh my god, such a dark, moody, bad subject to talk about, but it's an really, really important thing to talk about, isn't it? Because of course everybody's goal is that children should be happy and healthy so that they can grow into becoming good human beings, productive adults who are independent and taking care of themselves and being an asset to the community and to the family. So again, it's very important for us to even understand what child mental health is and why is it essential. So how do you talk about it? Like how do you talk about child mental health and various disorders?
Okay. So I have I have been working with children right from the start of my practice, and that's something that I really enjoy. I think I uh, I really connect with them at some level, and I enjoy talking to them and the conversations that we have. And so I think when it comes to child mental health, a lot has to do with the history that the parents are giving. So I make sure to spend a lot of time to understand the background. So the way the family dynamics works, the birth and development of the child, the growth of the child, academic, development of the child, any other concerns that the parents must have noticed, how the child behaves in a social situation, their equation with their siblings, other family members, and also the specific concerns with which the parents come to us. Very often they're broadly, either developmental concerns, like the child has not developed in the way that they were expecting the child to grow or develop, or it could be academic concerns, or it could be behavioral concerns. So it's broadly in these three areas that I see children. But like you, I also strongly believe that we should look at child mental health very seriously, because we know that a lot of illnesses and major illnesses have their onset somewhere at the start of adolescence. So we are looking at, maybe catching the early signs of illness and probably treating it at a very early stage if we are able to pick it up in children. Often I also feel that right now, the generation that we are living in, I think that parents are also a lot more focused on, the well-being of their child. Like, they would rather think about the child than about themselves. Like, they would probably not be sleeping well, but if the child is not doing well in studies or not engaging with, play with the other children, that will be the first thing that they come to us for. So like you said, it's like a window into the family. and a window into understanding what's going wrong with the mental health and what's going wrong with the support system of the family. The other thing that I look at is also, the importance of child mental health in building the next generation of coping, the next generation of resilience, the next generation of strength that the community is going to get. So if we work and if we are able to identify concerns and look at problems at an early age and build the coping from that age, it would probably look at better mental health in the years to come. So that's definitely one of my focuses when I look at children with mental health concerns. What are the kinds of concerns that you see in the OPD? What come to you?
So let me try and kind of like put what you just said in a little bit more scientific way. Sometimes I like to explain it in those terms to people from a biological point of view, because parents don't seem to sometimes grasp what it is, isn't it? And like you said, what do we do with children? First, we kind of like take the history, but then we also want to tell the parents what needs to be done and why. So let's look at a child. Child is newborn. Child is a few years old, whatever it may be. The child has inherited certain genetics, right? A genetic trace from the father's side, genetic trace from the mother's side. Now, the early childhood experiences, how the child was raised, whether the mother was attentive, whether the father was around, whether there was play, whether there was neglect, whether there was abuse, whether there was some physical injuries, some medical injuries, things like that. All of those early childhood experiences impact the gene expression, the genetic material that they have. That's called something like, in a very, very simplistic way, I'm trying to explain epigenetics. So even if something the child has been, born with, then the early childhood experiences impacts those genes, and that will impact the development of physical development, the development, mental development, social development, ability to not just have friends, but have meaningful relationships with parents, as well as later on with peers and friends and spouses. A development of educational, academic, professional skills. So that trajectory, that developmental trajectory that happens gets impacted by epigenetics. Now, that's why it's so essential for parents to recognize that if a doctor, if a psychiatrist is saying, let's say your child has an anxiety disorder, which is very, very common with children, especially when children also may have attention deficit hyperactivity disorder. So these are very common children that problems that we see in children, isn't it, in our OPDs? So if let's say that the child has anxiety or has ADHD or has both, so we understand that the arc, the trajectory, the graph of development is not going to be as smooth. That's why intervention is important, and that's why treatment is important. So that if there is something going on, like, the graph is wavy, we treat it so that the graph becomes smooth again, and then your child can develop into a healthier adolescent, which is a starting point of a whole lot of psychiatric as well as medical conditions, which may or may not happen, like get pronounced in adulthood. So children with psychiatric issues will grow up as more vulnerable adults towards physical as well as psychiatric illnesses. So that's why it's important that we look at the child mental health as well as intervene if there is a disorder during their childhood. So this is how I try and explain to people that it's genetic, and the genes are going to get impacted. So if they are going to get impacted negatively, we can also impact it positively. And like you said, build resilience and give them coping strategies that they become healthy children now, healthy adults, teenagers tomorrow, and healthy adults later. And if they're going to be healthy adults, they're going to be better parents for their future generations as well. And the other interesting thing is, because people tell me all the time that, oh, ye aajkal ke chochले hain, hamare zamane mein hum nahi sunte the aisa. So what I remind people is that yes, we are seeing more children with psychiatric illnesses, with mental health issues, with developmental issues, precisely because of a number of reasons. A, there's more awareness, right? There's more education. Now, right now, we have more educated young parents than we had 50 years ago. So when the parents are themselves are educated, they know what to look for. The sheer number of children have increased, right? Because India is a young nation, especially specifically India is a young nation, and we have lots more children. We have young people who are going to have many more children, and thankfully the mortality rate is low. So we can save lives of a lot of children who are going to grow into adolescents and adults, which is when we will see a lot of illnesses. That's why we probably talk more about child mental health now than we did even 10 years ago or 20 years ago. So it's not that all of a sudden, oh, children have become spoiled and that's why they have all of these issues. It's not that at all. It's just how the world is changing, and we need to change with the world. So, taking off from there, when you do diagnose a child with anxiety or ADHD, what are the other kind of like common illnesses that you will see in children? And what are the possible symptoms that you would want, normal, regular individuals, parents, as well as teachers to learn and, have more information about?
Okay. So, yes, we definitely see a lot of ADHD and anxiety in the OPD. And along with ADHD, we also see a variety of learning related complaints. So, whether it is, academic concerns in terms of lowered intellectual capacity, or whether it is, the normal intellectual quotient with a learning disability like dyslexia, dysgraphia, or dyscalculia. We see this in the OPD very often. We also look at a lot of behavioral complaints. Like there are patients coming in with symptoms like temper tantrums, bedwetting, anger outbursts, sometimes even physical or verbal aggression. Sometimes there could be behaviors like lying, stealing. These could be concerns that the parents express. Of course, we look at the variety of symptoms that the parents present with, and then we look at what could be the more likely diagnosis. And I do see, children with, say, ADHD with behavioral concerns, or children with intellectual disability with, say, anger or aggression as a part of the symptom complex that they are expressing. So this is something that I see very often in the OPD. I also have a significant number of children coming from the autism spectrum who come with concerns of, either difficulty regulating behavior in certain areas, or frequent repetitions, or stereotypical behaviors which can interfere with their either with their sitting tolerance or with their capacity to focus on what the parent is trying to teach, or what the teacher is trying to teach to the child. So this is again an area. Of course, parents with children on the spectrum also reach out for aggression and anger outbursts, and that's another common complaint that we see in the OPD. Uh, Primarily, when parents and teachers uh, recommend that the child should visit the psychiatrist, the first response that the uh, parent has, or when they come to the OPD and they sit and they say that itne chote bacche ke liye kya zarurat hai. So we have to go through the process of explaining to them why it is needed. And I often make the time to explain to them that if there was no impairment in the behavior, or if that behavior was not impacting the child's functioning in a particular area, whether it is academic, whether it is social, or whether it is in their biological functions, then we don't need to do anything. And then we just need to work in a slow and steady manner to try and modify the behavior, either using occupational therapy or behavior therapy. But in times where it has become significantly disordered, or where the child is not able to engage in a particular activity or a particular behavior because of the symptoms, then it becomes imperative for us to consider medications. So of course we look at all the different facets before we take a call on medications, and we don't just simply directly put the child on medications because they've come to us. In fact, more often than not, when children come to us, I often recommend assessments, and if the child is really young and doesn't have very significant complaints, I often ask them to try therapy first and see if that works. And then we do like a review in 3 months, and then see how things would go, and if the child is doing better, if there's an improvement or not. If there's no improvement, then I look at medications. But I think that also works well with some children. Uh,
I tell parents, you have to earn medications. I tell parents, first you have to improve your home environment. You have to improve your interpersonal relationships. You have to learn parenting skills. The child has to go through occupational therapy. The child has to look in from a nutritional point of view. We have to work with the school, see to it that the child is getting the attention and the requirements that the child requires. So that learning becomes easy, because learning is directly kind of proportional to their self-esteem at that age. So because I tell people that I know that your child requires medication and I want to give your child medications, but irrespective of medication, all of these things are very important, essential, imperative for the better outcome of your child. Because we know, right, more than adults, children are the ones that are going to get affected by their environment around them, by the health of
Absolutely.
their caregivers, by how peers interact with them, how teachers interact.
Absolutely.
Even a simple thing like whether the room is well lit or if it's a small dingy place. So essentially, I actually tell parents that I've had parents who've just gone away and haven't come back to me because I've told them that no, first session I'm not giving medications, you have to earn it. So so not to say that we discourage medications. In fact, not at all. In fact, a lot of the times we're kind of like um, fighting an uphill battle where teachers are so kind of biased against medications. Unfortunately, certain
Yeah.
psychologists will also say that no, don't take medications. And here I'm like, if my child required some treatment, so that not only for right now the child will get better, but also that my child has a better chance of developing into a normal, healthy
For the
adult, of
future.
course I'm going to give my child that medicines. Imagine if my child has asthma and I tell them that no, I'm only going to do breathing exercises with him and just do some steam inhalation, and I won't give him medication so that his lungs get a chance to develop normally. I mean, I can't even imagine that. So of course I'm very pro medications when it's required, but we always have to be very cautious with children, and we tell parents all the time, reassure them, we're not going to underdiagnose your child, we're not going to overdiagnose your child,
Yes.
we're not going to undertreat your child, and we're not going to overtreat your child. And that's why it takes a team of us to kind of help with your child. So even when child rearing, it takes a village, even child treatment takes a village. We work together so well with psychologists and therapists and occupational therapists. We do parenting skills, we do parenting workshops, because all of that is required for your child to be healthy now, and for your child to be healthy tomorrow as well. And I think when you have that kind of like a clear kind of discussion with them and occasionally put your foot down a little bit, our parents do kind of like understand what we are talking about, you see.
Yeah.
And it's important for, well, again, for us to use these kind of like biological terms, because then they understand that, oh, I'm not just saying something off the top of my head, I'm
Yes.
actually saying this because this is backed by science.
Yes.
And that makes them a little bit more confident about doing the right thing for their kids, because parents do want to do the right things with their kids, isn't it?
Absolutely.
Of course, there are certain sections, maybe the parents are the ones who are the part of the problem, not the part of the solution. There could be neglect, there could be abuse. So in those special circumstances, we do require special kind of interventions. And we hope that every child gets the benefit of love and encouragement and acceptance and approval. Having said that, there are cases where we do need to intervene from a different point of view. But I think for today, let's not kind of like digress into those topics, and we will probably do an entire section on that.
Yeah.
So what do you do? Like, how do you, when we're giving treatments in terms of medications and everything, um, and so what are the outcomes that you're looking for, like when you're starting a child? And how often do you tell children to come and see you, and how often do you think that the children require to be seen? And how do you manage?
Okay. So it's like you said, like we discussed earlier, by the time we make the decision to start medicines, it's always when it is absolutely necessary and we don't see that any other thing could help the child before the starting of medicines. Like for example, if it's a child with severe ADHD and the parents are insistent on therapy, but you and I know that therapy is not going to go anywhere because the child is not going to be able to sit in that chair for more than 5 minutes, that a 1 hour therapy session is out of the question completely. So, in such situations, when I would consider starting medications for the child, I would first look at getting some blood tests done to see that there is no medical issue that, of course, when we take the history, we ask about background family and child medical history. But it's always a good idea to get some blood tests done. So like thyroid, a regular CBC, liver function test, everything. I just get like a basic, screen done for the
Because
child.
that's also going to help in diagnosis, right? I mean, what if we think
Absolutely.
that the child is low, but the child is
Actually,
hypothyroid? So of
hypothyroid.
course,
Yeah. Yeah.
yeah, yeah.
So once that basic screening is done, then we look at the dose that we're starting on. I discuss with the parents what kind of medication they would prefer. There are some kids, like I've seen some even 7 and 8 year olds who prefer taking a tablet, and 10 and 12 year olds who prefer a syrup. So then I discuss with them what formulation they would prefer, and then I offer them the choice of which medication I think would be right for them. Usually, when I start a medication, I like to see the child again, maybe in 10 days or 2 weeks at the most. I don't give a longer follow up for the first appointment. If the child is starting on medications, and I know that, there are, say, like for example, we know that when we start the child on ADHD medicines, there can be an appetite loss that the child might experience. So then I talk to the parents that this might be the concern that you experience, so that they're not panicky and they're not worried about what's happening with their child and why the child is suddenly not feeling like eating. So I discuss with them that this might happen. I also tell them that it might not happen. It's a reported side effect, but it's not something that happens with every child.
And also, we
And
want them to look for these symptoms if that happens, so
exactly.
that they can come and report to us so that we can titrate the medications or the dosage or what have you.
Correct. And I also talk to them about what they should take care of. Like, for example, make sure that the child has eaten well before taking the medication, make sure that the child drinks enough water through the day, taking care of the sleep routine of the child. A lot of times, children only sleep when parents sleep. So that's
Yeah.
very often 12, 1. Nowadays, it's even going to 2, which is crazy. So, getting them to a scheduled routine, like where they are at least in bed by 10 p.m. and up by say 7 or 8 a.m., so that the child follows a proper routine irrespective of what the parents routine is. So I give them these basic pointers. And once the child is settled on medicines, if I'm looking at continuing the medicines for say a period of 6 months or a year, then I would discuss with them how long I would continue the treatment. And once the child is settled on medicines, I would call the patient only once a month. I don't think I would call them more frequently than that, because they would need to do say occupational therapy sessions or individual and parental counseling sessions, which would be far more frequent. So keeping that in mind, I make sure that they can come to the clinic and see me say once a month, and that seems to work well for most of my patients.
And we can't really not talk about the pandemic situation, because of which a lot of children have been cooped up inside the house, because we know that a huge part of development of children, normal healthy development of children, is pure interaction, playing around, just going out and running,
Yeah.
tumbling over, doing upside down shenanigans. So because now, when we do understand that, okay, because of COVID situations, we are not going to be able to let our children mingle with other kids as much as freely, we can't send them to school. It's very important for parents to understand how can they do uh, a psychosocial stimulation of their child, what kind of plays that they need, what kind of play interaction that they need to now do with their children, and not only just stress about, okay, you have to sit in front of the screen because your school is on, because yes, that is important, but I've been telling everybody, you know what, it's 2020. If your child is not doing well in academics this year, please don't worry about it, because that's the least of the concerns right now, and the child will make up next year, so don't worry about it. So it's important for, I think, parents to kind of reach out to professionals to figure out, based on how what their life is right now, and how can they kind of incorporate better parenting skills, better child development skills, that ordinarily they were kind of like getting passed over with the school, or with the friends and everything. So it's important for parents to reach out and take these kind of professional helps wherever required, how they can see to it that their children, because at 1 year I'm saying, yeah, academics, let it go, but we can't let everything go with children, isn't it? I mean, they're going to
Yeah.
grow. So, and they're going, and so we want them to still be very healthy and resilient, and still get the same amount of sunshine, the nutritional value, and play is such an important part of children, because that's how their brain develops, that's how the cognition develops, that's how they become smarter in life. So how to interact with that? So I think, on that note, I think, you and I can keep talking about it, isn't it? So if you want to just
Absolutely.
add a few words and then we'll sign off, what do you think?
Yeah, I think that sounds good. I just want to reiterate what you said and just emphasize that when this pandemic started and when the school started, me and my husband just made our peace with the fact that this year the children will run free and we will not achieve anything this year, and it's okay. It's completely okay because let's not look at every single thing as counting towards their development only in terms of academics. I think this entire experience has taught us that behaviors within the family with each other are far more important and far more impactful in the longer run than the grades that we get, the work that we do, or whatever else that is there. So I think let's just focus on the fact that we need to create a healthy environment for the child and create a happy environment for us within the family. So I think that's all I'd like to say.
So figuring out what's urgent and what's important, I think that's where we're at. So
Absolutely.
thank you so much, Dr. Wilona. Always a pleasure talking to you, and I love our sharing sessions here, and I hope that this is reaching out to a lot of other people, colleagues and regular normal people from from different walks of life, and they're getting something from these sessions as well. So the learning is not just mutual. I hope it spreads around. And here's Shrink Sharing signing out. Bye.
Bye.